One, we are live, sir.
Yeah.
அனைவருக்கும் வணக்கம்.
Hello, Mr. Suman. You could talk in English because so many Malayalis will be attending.
Okay. So, good morning, everyone. It's a pleasure to welcome you all again for this wonderful Sunday morning, which we have been doing since the last 3 years or 4 years almost. Every time we have wonderful speakers who open up our minds. And today, truly speaking, opening up our mind is we have Dr. Parvati, a senior psychologist with us. Ma'am, we see more than 100 patients, 200 patients every day. Apart from the physical illness, most of the problems seem to be rooted from here actually. So this is an eye-opener not only for the patients, but also doctors and all human beings in general. Because a healthy mind is first important before a healthy body. Even if your body is fit, if your mind is bad, things are going to go haywire. We all want to live ultimately a happy and peaceful life. Hence, I welcome you all on behalf of VGM Hospital family, which is a 150-bedded hospital in Trichy Road, Coimbatore, and Professor Rajaram sir, who has always been with us. He's the brainchild of this whole, every Sunday event. Since the last 4 years, he's been masterminding it. Thank you, Rajaram sir, for sparing your time and making this event always possible since all these years. So over to Rajaram sir and madam.
Thank you, Dr. Suman, my good friend, a very good orthopedic surgeon in Coimbatore attached to VGM Hospital. I just want to inform everybody, viewers, that is this program was inaugurated the then Vice Chancellor of Tamil Nadu, MGR Medical University, Dr. Chudha Sheshan, my good friend, very good orator in Tamil and English, and a knowledgeable medical person. So today we are Dr. Mohan Prasad is out of station. He is in Goa now. So I asked him to speak a few lines. He has expressed inability to do so. So Dr. Narayana Swamy, the person who is to inaugurate today's program, is down with the fever. So Dr. Narayana Swamy, I just say a few lines about him. He is professor of psychiatry in Coimbatore Medical College, and he did his MBBS Coimbatore Medical College and MD Psychiatry from Institute of Mental Health, Chennai. He is a very good psychiatrist and a very conservative person, conservative way of treatment he adopts. So I just come to the chief guest of today, Dr. Parvati, attached to Ganga Hospital, Coimbatore. She is a clinical psychologist. Her profile is really outstanding. She is a certified counseling psychologist, certified cognitive behavior expert, certified clinical hypnotherapist. See, so many diseases are getting cured by hypnotherapy. And she had two highly qualified MS Psychological Counseling and Psychotherapy from University of Bombay and PhD from Bharatiya University, Coimbatore. She is associated with various industries across India. She has successfully counseled more than 3,000 executives in more than 200 organizations. And she is expert in handling relationship counseling, work and productivity support, addiction and mood management, depression, anxiety, and lactation counselor. She handles clients from all walks of life and age span. Now she specializes on anxiety, depression, work, productivity, addiction, relationship, family, psychosexual, productivity, suicide prevention, everything. Suicide prevention means now it is punishable. The attempt to commit suicide itself is an offense under IPC. So we want as doctors, psychologists, to advise the person who ventures to commit suicide not to do so. Psychologists have saved the life of many people from committing suicide. The success of a good psychiatrist depends upon a psychologist. The psychologist, the psychiatrist gives medicines and gives some psychological advice. The psychologist gives the advice in detail, and the concerned psychologist deals with the patient in a very friendly manner. And now we have got Dr. Parvati, who is a well-known person in Coimbatore, attached to Ganga Hospital, and the chairman of the hospital is my good friend Dr. Raja Sabhavati. I just informed him. Raja Sabhavati is the head of the Ganga Hospital, Ramnagar, and I request Dr. Parvati to just speak on Maname Nalama, that is a Tamil title, and I would like to speak on clinical psychology. Over to Dr. Paras.
Thank you, sir. Thank you. First and foremost, thank you very much, Professor Rajaram, sir, for this opportunity. I should thank my chief, Dr. SRS, for introducing Rajaram, sir, to me. Thank you, Dr. Suman, for inaugurating the session. And this is an excellent initiative by VGM Foundation because this is much needed, that is to reach the public about various aspects of medicine. And as Dr. Suman rightly indicated, there is a lot of connection to psychology and branch of gastroenterology, especially. And we also see a lot of psychology and connection to pain and trauma. So that is one reason why you would not be surprised why what is the role of psychologist in Ganga Hospital, because the Ganga Hospital is one area where we deal with pain and we deal with trauma and we deal with a lot of rehabilitation of patients. So this is post COVID, likely this importance of mental health has drastically improved. Now there is a good awareness about what counseling is and why counseling is needed. And as a psychologist, I'm seeing that the stigma is largely broken. Now patients also feel comfortable going to a psychiatrist or going to a psychologist and explaining their problem. We have also seen school, colleges, and workplaces taking the role of counseling and mental health being very important aspect of their day-to-day life. So today we are just going to see an awareness about what counseling is and how mind matters. So that is what is going to be the topic for the day. So I have a very short presentation which I would like you to take through. Is the presentation visible?
Yes, ma'am. Your PPTs are right.
Yes, thank you. Thank you. So the mental health, if this speaks to you, what would it say? So this is some of the physical symptoms that we have all been through. So now looking back, this would have been one of our best childhood memories, if I have to put. We have had physical fevers, and when we had fever, we had mom sitting right next to us, taking care of us. And the best part of the viral fever in childhood was we were giving bread, butter, and jam, which we still relish. And we still know that if we had gastritis in childhood, then mom or dad always got a soda. So we pretended to have gastritis quite often because we wanted to enjoy the soda. So these are some of the childhood memories. And these are some of the episodes that is very common in human life, like having physical health. Have ever had a broken bone, ever had a cut your finger, ever had a headache, toothache, tummy ache, or fallen and been in pain? So these are some of the physical symptoms that we have been through. Almost everybody at least once in their lifetime. And when these physical symptoms come to us, we are very confident that we want to go to a doctor. We need a doctor because we go through this pain. And when we trouble in pain, we see others also empathizing with us because they can see an opened wound, they can see bleeding, they can see trauma. So others also feel empathetic that, oh, you have to rush to a doctor because you are in pain. Now what happens in emotional pain? Emotional pain is not visible. So the factor of empathy in emotional pain goes down. So when you go tell somebody that, look, I'm not feeling okay, the last 2 weeks have been really stressful, I have felt very fatigued in the last 2 weeks, my brain is stormed, I can't take a decision, I'm not able to feel an excitement. When we talk about this, the first response that usually somebody gets is dismissal. They say, hey, you know what? Even I have been through something like this. Or they would say, this would be okay. You should listen to Ilayaraja music. This should be okay. You should eat biryani. Or this should be okay. In 2 days, you'll be fine if you talk about it to somebody. So, this is the psychological first aid that people get. And over this, when somebody suggests that, you know what, you should go to a psychiatrist or you have to go to a psychologist, why don't you consider going to a psychologist? The next immediate response from that person, oh, no, 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 I'm not that bad, I don't need a psychologist, I can manage. So this is the immediate response. And I think most of the time doctors have also told me that when they refer a patient to the psychologist, the patient's facial expression changes and they ask the doctor, what do you think is wrong with me? Na paityama, That is the next stigma response. எனக்கு ஒண்ணும் இல்ல, நான் பைத்தியமெல்லாம் இல்ல. So this awareness session is really important for people to understand what are the different circumstances in which you can see a psychologist. So as Dr. Suman rightly indicated, sometimes the root of the pain is just your mind. And most of the time, if you are able to heal your mind, you will see your pain also getting better. So the mental health and medicine go hand in hand, and that is the reason most of the time you're referred to a psychologist, so that you can be more open about pain. You can talk about your triggers, you can talk about your worries, and that eases any problem that is well defined and discussed gets eased. So that is exactly why a counseling session helps you. So mental health is all about how we think, feel, and act. So this is like fingerprint, everybody has a different reaction to mental health because our stress tolerance levels are different. So we are basically three categories of people. Some of us, when there is a problem, we freeze. Some of us, when there is a problem, we fight. Some of us, when there is a problem, we just flight. We just want to escape from the situation. So among the three category, just like physical health, mental health issues, everybody has it. But somebody can handle it on their own. Somebody will feel better just by discussing with a good friend or a mentor. Or somebody needs a psychologist where they need to confide about what they feel and seek help. So this tolerance level, like pain tolerance on a pain scale, the mental health tolerance level also largely changes from one person to another. So what is a society's view? There is still a lot of stigma in the society. People still feel a little uncomfortable discussing to a stranger the problem. And what is their main concern is the issue of confidentiality. Like, if I go and open up, how much would this be kept confidential? And many people don't even identify their feelings, or don't know how to express it. That is their concern. And people should know that it is very, very healthy to talk about your feelings. And why you should talk to a psychologist? Because a psychologist is trained to process your feelings, and the psychologist will have the time and space for you to express it. So this narration between the psychologist and the patient largely comforts the patient. So this is a slide of popular Bollywood actors that we know have been through depression. Yes, you will see Deepika Padukone, one of the very, very famous actress, have opened up that she's been through, terrific depression and even felt suicidal. And she took help, and then now she has started a mental health foundation. And you will see Karan Johar, who opened up about his orientation. And we have Hrithik Roshan, post his tumor surgery, had behavioral changes and has opened up about how he, sought help and came out of the depression. A lot of people, you will see Shraddha Kapoor talking about depression and eating disorder. So a lot of celebrities are now coming forward, starting up foundations, partnering with foundation for mental health. And this side is the most interesting quote by Prince Harry, who better can talk about it. So the experience, Prince Harry says, the health struggle is, uh, when you get a mental health struggle, you actually understand that you are a part of a big club. So you're not alone. The struggle is for everybody. And Prince Harry, as we all know, have been through this depression since childhood, where his mother also struggled with mental health issues and eating disorders because of the pressure from the bureaucratic family and the media. So many celebrities have opened up about mental health. They are coming public to break the stigma. So most of the times we see mental health and mental illness are interchangeably used. So this mental health is a state of mind and emotional well-being, while mental illness is a diagnosis. So the public should understand that in the field of mental health, we have two specialities. One is a psychiatrist, who is a MBBS qualified psychiatrist who prescribes medicine and also gives counseling. The other is a psychotherapist or a psychologist who do not prescribe medications, but gives you extended therapy to get you out of the issue that you're facing. So these two disciplines go hand in hand in psychiatry, in the department of mental health and behavioral medicine. We have been talking about what is well-being. So what is well-being? So well-being generally indicates about how you feel today, how you're able to think, your relationship with others, and do you find a meaning and purpose in our life. So when you wake up in the morning, do you feel like achieving something today? When you wake up in the morning, would you feel like going to job, to the work today? And at the end of the day, when you come back to bed at night, do you feel you have achieved something great today, or at least you have done something, nice today? So these are some of the factors that defines well-being for us to understand. And why well-being matters? It matters because it boosts your self-esteem. When there is no well-being, you would not feel like getting out of your bed. There will be a lot of pessimism, self-doubts. But when there is well-being, you will have a lot of optimism. You will look forward to do great things. Your resilience or tolerance will increase, and your self-determination will increase. You will have a better physical and mental health. So as we are seeing here, physical and mental health go together. So that is the secret. So what is a self-care alarm? So when are you supposed to seek help? When you're unable to switch off your automatic thoughts, when you start overthinking, and this overthinking largely affects your quality of life and work, that is the time you have to think about seeing a psychologist. When you feel stressed or when you feel overwhelmed, especially when you're not able to contain your emotions, where you feel like there is cry spells, there are panic attacks, there are disturbances where you're not able to handle, or where you're being pricky, that is irritability, where your tolerance is going down, where your aches, pains, bumps and lumps start feeling visible, there also mental health could have a significant problem. Where you make plans, you want to enjoy with friends, but you cancel the plans because you're just not able to do what you want to do. And then when you're feeling lonely, and when there is irrational behaviors that you cannot explain for. So these are some of the self care alarm where you have to consider about seeing a mental health expert. So if this is extended beyond 2 weeks, then you need help. So when is this help needed? When you have physiological changes. So what kind of physiological changes? Sometimes changes in your eating, sleeping patterns. Sometimes you want to just withdraw from people, you don't want to talk to any of them, you want to be a loner, just don't want to get connected. When you have no energy, when you feel hopeless, when you feel depressed, and sometimes when you're attracted to use alcohol or drugs, when you have severe mood swings, when you have thoughts about harming yourself, the self harm, or you feel extremely stressed, forgetful, or worried. So these are some of the physiological symptoms which, when extends beyond a month or beyond 2 weeks, it is time for you to understand that you have to ask for help. And at this slide, I would like to tell you that most of the people hesitate to ask for help. So asking for help itself is the greatest strength that human need to develop. So a deeper dive into when what a psychologist does. The psychologist helps you to understand your inner peace. So the psychologist helps you to understand from where is this pain points triggering. They help you to realize and experience the deeper meaning of purpose. And they also help you to understand your challenges, and understand your strengths, and they work more on your strengths so that you can handle it better. So this is what is inner well-being that we focus in counseling. So the best lesson for us is we must stop outsourcing our problems. That's the best thing. There are a lot of TED talks, beautiful TED talks, which we can go through. This one is a very beautiful TED talk which tells us that happiness is all in your mind. It's an amazing talk by Jen Klinger, and it talks about the principles of Buddhism, that you can, the Tao, the wisdom of Tao, that you could put in mental well-being. So it says that just like breathing, you have to make happiness also a part and parcel of your life. So happiness is a habit. Happiness is not a choice. So that is what this talk beautifully talks about. Yeah. So why somebody is able to be happy and don't need help when somebody is not able to be happy and need help. We use this beautiful analogy in counseling, that is, on a sunny day you go out without sunglasses, you find it little difficult to adjust your vision and enjoy the scenery. But when you put on your sunglasses, you see the same scenery, but you see it better. So that is how counseling helps you. So counseling is a sunglass. When you put it on, you will see that it doesn't change the scenario outside, but it only helps you to change your perspective outside. And you will see that when the perspective changes, the vision and intensity of the problem also changes. So this is the analogy we normally use. So the next time you consider about going to a psychologist, don't shy away. It's just like wearing your sunglasses. So a good mental health is essential for progress, and a poor mental health makes it very difficult to cope. This is one of the statistics. Unfortunately, 3 in 5 young people have either experienced a mental health problem or close to someone who has. It will be very, very interesting for you to know that a mental health issue can start from the age of 3 years, where children start feeling depressed very, very early in life because their exposure to the environment, external environment, and problems are also uh, that way. And it starts from parenting. So right from parenting, it enters into the young adulthood, and then it aggravates in adolescent. And then you see that there are certain habits which are not addressed in the childhood becomes pain points when we grow into adults. So the childhood history and addressing mental health issues in the childhood is also equally important, because from there is what most of the things stems. So whatever you're experiencing, it is important to know that you're not alone, and everybody deserves support. So how can you help yourself? Talking to somebody you trust will help. Exercising is the best medicine. As I always tell, the best medicine to a good mental health is sunshine and sweat. So when life is not sedentary, and when you get a lot of sunshine and sweat, you will see that most of your problems get out, and your decision making ability becomes better. Trying calming techniques. So it's not just meditation, but anything that you're able to calm with a good music or a good walk or a good sketching, anything that calms you. Learning a new skill. Now, most of the time in young adults and adolescents, we see that they don't have hobbies. So they are so addicted to gadgets that they don't have playmates, they don't have hobbies, and they have a lot of time to worry about things that they truly don't have to worry about. So, finding a meaningful passion, finding a meaningful hobby is very, very important. And spending time with people that you care about. This is one interesting information during Corona when we were into counseling and we were in the ward. We have seen most of them not dreading disease or death, but most of them actually dreaded isolation. And that is the reason why they felt, oh my God, Corona, because they have to be isolated for 5 to 6 days. And this was the time most of them, when they were critically ill, wanted ventilator or wanted oxygen support. All after they felt better, they spoke to us and said, wish I spent more time with my children, wish I spent more time with my parents, wish I spent more time for myself. So that was the regret that we saw in the ward. Doing some volunteering work, contributing your skills to people who need it, and creating something, getting into expressive arts, that would help you. Most importantly, congratulating, appreciating, and having gratitude. So these are some of the tools which is very important for a critical mental health. So ask for help, not because you're weak, but because you want to remain strong. So what is counseling for people who haven't taken but want to know what counseling is? It is just a purposeful conversation between you and the therapist, where the therapist helps to identify the problem and tries to break the problem into smaller steps so that you can understand what you're really going through. So that is what happens in counseling. So, what do counselors help with? We not only help with psychiatric issues, we also help to adjust with traumatic events, emotional health. We help with grief counseling, which is bereavement, addiction. We also help with your work, relationships, and progress. We address phobia. We talk about financial problems as well as family issues. So, in any perspective of life, when you feel a setback, you can always take a counseling to put you back into track, or at least look at it with a new perspective. So it is not always a psychiatric disorder, but even your general day-to-day adjustment issues also fall in the perspective of counseling help. So, what happens when you take counseling? You get a greater self confidence, it improves your relationship, it increases assertiveness, and you are able to set boundaries, which is very, very important. So, most of the time, when you go through trauma, you're going through an issue, you would see that you cannot draw a boundary. So, when the counselor comes into the picture, the counselor tells you where you have to draw the boundary, and the counselor also helps you to get adjusted to this. Not breaching the boundary that you have defined. So, this is what happens when you take. How to pick a good therapist. So, you should be very comfortable about opening to this person. You can be open to ask the therapist about her qualification, training, and you can also ask about what kind of cases he or she has dealt with, experience with clients. You can also ask about your own personal therapy plan, and they should be able to put you at ease in the first conversation. So this rapport that you build is very, very important for a counseling. What happens in a therapy? As sir rightly said, when it says hypnotherapy, most of us come and ask us that, would you put a pendulum and hypnotize, because they have seen all that in the movies how they do it. So that is not how clinical hypnosis is done. So it is narrative therapy. We talk about stuff that are repressed inside you that even you have not realized. We help you to grow. We even we talk about attitude, and don't worry, when you cry, we don't take it rude. We are trained to handle it. You can express your fear, guilt, shame, etc. And we help you to, unburden yourself of worries, and we also indicate to you what kind of clinical progress you're doing, so you know realistically where you're going through. So what do we do in counseling? We talk about your experience. We help you to see the experience in a different perspective, and we also tell you how to change your perception and look for solution. So this is what we do in counseling when we talk to you. So, how to assess the right therapist, or how to assess if your therapy is right? You should look if your therapist is authentic. It all depends on what kind of a therapist you pick. And it is important that the therapist gives you a lot of time to express. The therapist is not judgmental, the therapist empowers you, and the therapist lets you talk. So, these are some of the indicators for you to understand that your therapist is making the session more comfortable for you. So, how do you know it works? When you start feeling lighter, when you're able to readjust your boundaries, when you're able to, express yourself freely without being judged, and when your need for validation dissolves, and it gives you an opportunity to celebrate your progress, you will understand that you're actually visually healing. So the things to remember is setback don't equal failures. You are allowed to set boundaries. You are more than an illness, and it's okay to rest. Not everything you think is true. So these are the principles for mental health that we have to strongly believe. So this is a short presentation for mental health. Maybe we can have the session open for any questions or discussion. Thank you.
It's not truly, it's on YouTube, ma'am. It's more like people drop
Okay.
questions.
Okay.
Let me just see if anything has come up. Rajaram sir, anything meanwhile, sir?
I think sir is on mute.
சார் நீங்க மியூட் பண்ணிருக்கீங்க ராஜாராம் சார்.
Okay, right. Am I audible?
Yes.
Yes,
Yes,
ma'am.
sir.
Yes, sir.
Okay. I really appreciate the talk, critical analysis on clinical psychology by Dr. Parvati, and she has outlined the principles of mental health, the importance of mental health. I remember to have read one article in Tamil by one psychiatrist by name Dr. Srinivasan of Kovai Medical Center. He says, mind is a part which is not visible. Manamam or urupagum. Mind is also a part which is not visible. So, doctor said, as Dr. Paru said, even though the trend is there, suppose the doctor says, the physician says that you see a psychiatrist, he says, am I mad? That is the trend. So still the trend is there. They don't understand the importance of psychiatry and the psychology. And so many illnesses which cannot be cured by physicians got cured by treating the patients, by putting care, giving care to the concerned person, giving hypnotherapy or what he said, doctor dealt with therapy in detail. By therapy, by periodical assessment, he is able to overcome examination fear, suicide, alcoholism. Those things can be prevented, very well prevented, with 100% success by a psychologist and a psychiatrist. And I would like Dr. Suman to put some question or clear some doubt regarding doctor's talk. After that, if there nobody else, I'll go for the water tank.
Okay. Yeah, thank you, sir. Two things, ma'am. I like those powerful words. Happiness is a choice. It's ultimately our choice how we want to live. The life is very short. All of us have 60 to 70 years. If this one point imprints in everybody's mind every day, it's going to be a big boon.
Yes.
And I was a little, I started smiling when you said the word biryani. Sunday being, you put everybody in the mood, I think. Okay. And we are a family of orthopedicians and gastroenterologists. All these gastroenterologists say, don't eat this, don't eat that. I am a good person. Orthopedicians say, eat everything.
Eat everything.
In fact, every alternate day operate on a knee replacement. And when I discharge, they say, "Sir, என்ன சாப்பிடக்கூடாது அப்படி கேட்காதீங்க. Tell me what at all you can eat. வீட்டுக்கு போனா முதல்ல பிரியாணி பண்ணி சாப்பிடுங்க." And you know, that smile which immediately comes on the patient's face, it's not the medicines, it's not the exercises, but something they like, what they look forward to. Each people seem to have their own fantasy. Like one person was so depressed 3 days, it looks like he doesn't like Times of India, but the Hindu. He's like, I want to go back to my home, sit in my easy chair and read the Hindu.
Yes.
So people seem to have different, we can't call it whims and fantasies. They have their own love and lifestyle, something like that. So if everybody identifies that, I guess it's a matter of having a healthy life.
Right, sir. Right.
But I have a question now.
Yes.
I see many people in different age groups. I'm basically a person who sees 15 to 30 sports injuries and also geriatric population. This 15 to 30, they always seem to be in a lost state of mind. When they even present a complaint, they use funny English slangs, which is not truly a Coimbaturian slang. From here, they'll jump to here, then they come to here, the complaints. They seem to be haphazard, this thing. So any advice you have for these youngsters or this IT guys, something?
Because that is how the Google has presented, sir. Those complaints are Google order.
Okay, that is true.
I'm also saying, being in an orthopedic hospital, a lot of population in this age group, largely we see have a very compromised nutrition. That is the first reason where I have seen that they have constant aches and pains, and they are sedentary. We still remember our childhoods at that 15 to 16. Though we were in 10th and 12th, we never compromised our game. We never compromised the activity. And at least after school, we managed to have 1 hour of play. And childhood, literally parents have to drag us back home. Namakku playmates irundanga, odi veladi irukom. We still remember our childhood friends. But now I'm seeing that these children are constantly sedentary, and everything is online for them. Whether it is their work or whether their homework or even music class and the other classes, chess class is also online. Yes, music and chess is also online. So interestingly, in the last 2 months, I have seen, as you said, age group from 15 to 30 with a lot of complaints of the wrist. I think as an orthopedician, you would have also
extensor
yes. And we have seen that it is because of their addiction to gadget. And this 15 to 18, they struggle to get back to handwriting. That is another observation that we have seen. And children come with complaints that they are not able to complete their paper in half yearly or quarterly because their writing speed is not okay. So they come to an orthopedician to ask, how can you increase my speed of writing? And then we have to counsel them. The first cause is poor nutrition. The second cause I'm seeing is they are very sedentary. The third cause is the pain tolerance level has gone down. And probably that is because a lot of Googling, and they decide what they have. There was a child which came to me as 15 years old. Sir, SRS sir has done a surgery. A child is healed well, actually, because it was a surgery in the thumb. But now the child comes and says, I feel my whole hand is getting numb, but actually there was nothing. So there was a lot of somatization that the child was going through, and merely by psychological counseling we could heal. And when I understood what was the cause of the complaint, I understood that the parents were constantly fighting. They were the verge of separation when this child had an accident injury. So during this, the parents have given a lot of care and attention to this child. So now the child doesn't want to miss it. So the child knows, if I heal, then these people are going to do that again. So the child has constantly kept the parents and toes, complaining about pain, and it was an attention seeking syndrome that the child was going through. So these kind of a lot of psychological, we never guessed that it could be a family issue that was causing, the child was complaining of pain, and it was an acting out. But however, we could solve the family issue, and then there were no complaints with children. And this 25 to 30, we again see extreme obesity, sedentary lifestyle, and the attitude to even try to get into a healthy lifestyle is getting difficult to them. So that is one drawback that I see in this age group. Even after advice, even after going through, they feel it very difficult to get adjusted. And unfortunately, increased incidences of addiction to smoking and other substances have also increased. So
So,
the
doctor,
coping mechanism is different for this age group. They don't find a meaningful coping mechanism, but rather have become addicts to other
Gadgets and all this
mechanisms.
other things.
Yes,
Hmm.
yes.
Dr. Suman, I have got a point to mention here. Dr. Mohan Prasad is a leading medical gastroenterologist. My memory goes back some 10 years back while I was in Chennai. Uh, the, the concerned physician put him to a gastroenterologist there, and the gastroenterologist, the concerned, the patient was suffering for having some mental problem, some depression, and the concerned gastroenterologist put him to a psychologist and then a psychiatrist. After that, it got cured. So, a question of three tier, that is a gastroenterologist plus a physician, gastroenterologist, and also a psychologist. So, if you worry too much, you will get gas, you will get excessive secretion of hydrochloric acid, you will get heartburn if you worry too much. Then one more thing, orthopedic surgery, that is also connected with psychology. This also happened in one of my friends' life some 10 to 15 years back. That also in Chennai. I was there for quite a long time. A friend complained of back pain, acute back pain. The concerned orthopedic surgeon, I remember his no more, one R.I. Srinivas, long back. He put him to a psychologist, and psychologist put him to a psychiatrist. That person having acute backache, low backache, was having depression and anxiety. So the depression and anxiety should be relieved first before getting treatment by an orthopedic surgeon. Then orthopedic surgeon takes over, and that person becomes 100% all right. So the concerned orthopedic surgeon directed him to meet a psychologist. The psychologist in turn asked him to meet a psychiatrist. Medicine was prescribed, one or two medicines, and then psychological counseling was given. And all the people joined together. His backstage became all right. No operation was required. So here we have got the gastroenterologist, medical gastro, Dr. Mohan Prasad, and also a leading orthopedic surgeon, a flourishing orthopedic surgeon, my good friend Dr. Suman. Thank you very much, sir. Then over to Dr. Suman to speak a few lines. After that, the usual vote of thanks.
So there is one question in the come here. Can I answer? Madam, can I read it out and you
Yes,
can?
yes, yes,
Yeah.
sir.
It's about, there is, I think it's from a senior citizen. They're asking, my children are out of the country, only me and wife are there. How do you think we should spend time? Because we are feeling kind of, I think, lonely or something like that. They're putting across. I'm just,
Yes.
it's a long question. I'm just compromising it and telling it
Mhm.
short form.
Okay. Yes, quite a lot of this age group, they go through something called an empty nest syndrome, where
Sorry, what is it?
empty nest syndrome.
Okay, okay.
It is empty nest syndrome.
Nest. Okay.
Nest, yeah, because almost most of their lives they have contributed toward their children, their growth, their growing up and settling down. So they had something to look forward to, and all of a sudden children settle and they go abroad. Parents are happy that children have gone to find prospect, but they find very empty, because there's nothing to do now. They are left to take care. And at this age, this you will look forward to companionship. So this is a stage where you must actually start living for yourself, and not worry about what my children would do, what my grandchildren would do, what they ate, what they did, they sleep and all that. So what we advise this population is, you must have a good set of friends. This is actually the right age to make friends. So a set of friends, learn a new skill. Probably I always tell them to play word games. I tell them to learn how to play chess. I ask them to learn a new language. So something like that. And the spiritual quotient can be increased at this time. Spiritual doesn't mean religion. It can be anything. Say reading, or it can be having a part of a club that discusses about intellectual stuff. So this is the time where they need intellectual companionship. So this is the time where you can join forums, or probably start volunteering in any of your schools or centers nearby, and sharing your experience with the forthcoming generations. And a lot of things is actually possible that will keep you healthy and find purpose. So when you have purpose, and when you have something to do, when you have something to look forward to, that will never weaken you. So that it'll always keep you on toes to do something. So this is the time to look inwards, and this is the time to give back. So this way you can keep yourself engaged. So there is no time for overthinking. The enemy at the geriatric phase is the lot of time.
Lot of time available.
Yes.
Okay. I think that's all from this side. So, Rajaram sir, I think we've had a good thing. Would you like to add on anything, madam, here at this junction?
At this junction, I would just want to add that when you're referred to see a counselor, or when your treating physician feels narration with a counselor can help, and most of the time it helps your treating physician also to get a better picture of your disease. So, not to feel stigmatized, but be open to discuss. Be open about your mental health. As Rajaram sir rightly said, mind is also an organ. So, just like you would treat your toothache and tummy ache and your bone ache, I think we should not shy away from taking psychological help.
So, usual water thanks. We are really fortunate to listen to a very good lecture. Apart from being a very good counseling psychologist, she has proved to be a very good lecturer. She has got all the qualities of a professor. The lecture was entertaining, informative, and illuminating. And she has covered almost all tenets of psychological counseling about 30 to 35 minutes. And the discussion put forward by my good friend Dr. Suman is really thought-provoking. For that, Dr. Parvi discussed very much and gave very good reply and very good satisfactory reply. Dr. Parvati, busy with so many assignments today, found time to give audience to us to speak few lines on clinical psychology, Maname Nalama. I was discussing the topic with Dr. Mohan Prasad. I have fixed Dr. Parvati to give a talk, to participate in the talk show. please give me a date. He said 18th to be okay. So at that time he was very free. Suddenly he has to go to Goa, and doctors, surgeons, he felt, but that has been neutralized, and Dr. Suman took over, and he did his job very well. So the talk was very much interesting. I am very thankful to Dr. Parvati for giving a very good, thought-provoking talk. Now I come to Dr. Suman, who is a leading orthopedic surgeon in Coimbatore, attached to the famous and popular VGM hospital, of which Dr. Mohan Prasad is the chairman and Dr. Suman is the director. Dr. Suman's wife is a very prominent medical gastroenterologist, if I remember correct. And in the absence of Dr. Mohan Prasad, Dr. Suman did his job very well, and really I am very thankful to Dr. Suman for sparing some few his valuable time with us to participate in this talk show. So I really thank Dr. Narayanaswamy for giving a message, sending a message, stating that he's not well. He's down with fever because today only came from Chennai. He's down with fever. So we'll utilize him for something else later. I am really grateful to Dr. Mohan Prasad for continuing this talk show for third year. For last 2 months it was not there because of our busy schedule. Again it has started. So I request Dr. Suman's participation, the encouragement to go ahead with our program. So I thank you all listeners who came over here. I have I shared the invitation and the link to many people. Some people have come, and other people can view through YouTube. So thank you very much. All the very best. Bye.
Thank you, sir.
Thank you,
Thank
Raja.
you, Dr. Suman.
Madam, thank you so much.
Thank
for
you, sir.
wonderful
Thank
thing.
you.
Not only
Thank
as a professional, you're a homemaker too. You're sparing time away from kids for the wellness of the society. Really appreciate your thing.
Thank you.
Thank you so
Thank
much.
you, sir.
Thank you.